Thank you everyone for having us and letting us give this talk today. So we're talking about blood flow restriction, or more commonly known as BFR. So what is BFR? A cuff is applied to the upper portion of an extremity to partially occlude blood flow. So the cuff you see pictured here is usually what we use. It can be very helpful after surgery or an injury. It allows us to do strength training with decreased joint stress, and we can maintain strength with or during decreased training. So how does it actually work? The cuff is inflated so arterial blood can enter the limb, but venous cannot exit, or the area specifically. This allows the muscle to fatigue quickly, which increases muscle recruitment even at these lower loads. This slide lists the benefits of BFR, which short list, but there are many. One thing is that BFR allows patients to train at about 20 to 30% of their 1 rep max, whereas traditional strength training is usually about 70%. So it's helpful in post-op patients, people with joint pain, older adults, or anyone with an injury. And then specifically in post-op recovery, using BFR a few weeks post-op has been shown to increase strength. One study listed here showed significant increase in lower extremity strength with just 9 BFR sessions post-op knee surgery.
All right, so a case example. We discussed post-op ACL earlier today, so we found research based off of the post-op ACL. This one particular study looked at the effect of quadriceps training at different levels of blood flow restriction on the quadriceps strength in that midterm postoperative period after ACL reconstruction. It found that the BFR with low intensity strength training can improve strength and quadricep girth. 8 weeks of compression training improved quadricep muscle strength, and 80% arterial occlusion pressure was really that sweet spot for what was needed. Why is this important? Quadricep weakness has been associated with negative short-term and long-term outcomes, leading to low return to sport rate, reduced quality of life, and early onset OA. As with anything, there's safety considerations, so ultimately there's contraindications. Usually we avoid using blood flow restriction on patients that have a history of a DPT, a clotting disorder, peripheral vascular disease, uncontrolled hypertension, cancer, open wounds, active infection, and anyone with vascular compromise. As with anything, there's side effects. However, most of them are temporary and usually resolve after the cuff is removed. What we typically watch for is pain, any numbness, anything that seems like it's a vascular or neurological impairment. And like I said, we usually remove the cuff and patients see a resolution of their symptoms. Ultimately, blood flow restriction is safe, and as long as we screen correctly and respond quickly to what our patients are telling us, it should be okay. Okay, lastly, why should we care? A lot of us treat patients that can't manage heavy loads. They're post-operative, they have acute injuries, they are people with pain, they have fear of movement. So these are traditional limitations. Blood flow restriction can give them meaningful training stimulus far earlier in their recovery. So think back to those ACL reconstruction patients getting strength benefits from just body weight activity early on at week 2, week 3 would be great. For athletes, managing joint load as well as delayed muscle soreness and fatigue while they're in season is also a big thing. So blood flow restriction could help us maintain and build strength with minimizing the stress as they're in their season playing. Also think about the older adults, those individuals with chronic conditions that may be contributing to muscle wasting. For them, heavy load training may be contraindicated. So BFR may give us some opportunity to intervene without overloading their systems or their joints. So ultimately, BFR doesn't really replace the skills that therapists have, but it does give us another tool in our toolbox. The real question is, how might this change your practice if we can change low load to not mean low stimulus? Thanks.
Thank you.